A report that the Justice Department is investigating UnitedHealthcare's billing practices for Medicare.
America, another bombshell just dropped that's sending shockwaves through the healthcare industry. UnitedHealth Group, the largest health insurer in the nation, is under criminal investigation by the Department of Justice for Medicare fraud. Their stock has nosedived 70%, their CEO suddenly resigned, and billions in market value have vanished overnight. This isn't just another corporate scandal. This could be the biggest healthcare fraud in American history.
The Department of Justice is carrying out a criminal investigation into UnitedHealth Group for possible Medicare fraud. That's according to a Wall Street Journal report. While the exact nature of the allegations is unclear at this point, the report says that the probe has been active since at least last summer. And the news comes just 2 days after the company's CEO, Andrew Witty, stepped down unexpectedly.
What is up, guys? Tyson Dela Cruz here. Thank you so much for rocking with me. This UnitedHealthcare scandal is absolutely wild. The real corruption in our healthcare system isn't coming from the doctors or the patients. It's coming from these massive corporations that have figured out how to game the system and milk taxpayers for billions. Let me break down what we know so far. According to the Wall Street Journal, the Department of Justice Criminal Healthcare Fraud Unit in New York has been investigating UnitedHealthcare since at least last summer. It's not just some routine audit. This is a full-blown criminal probe.
UnitedHealth Group is under a criminal investigation by the U.S. Justice Department for possible Medicare fraud. That's according to a Wall Street Journal report Wednesday, which cited people familiar with the matter. While the journal said it's unclear what the exact criminal allegations are, they say the investigation has been active since at least last summer, undertaken by the Healthcare Fraud Unit of the DOJ's Criminal Division.
The investigation centers on UnitedHealthcare's Medicare Advantage billing practices. Specifically, they're suspected of inflating risk scores to secure higher payments from Medicare. Essentially, they're making their patients look sicker on paper than they actually are so they can bill the government for more money.
Yeah, so as you said, the Wall Street Journal reported last night that the company is under investigation for possible criminal Medicare fraud. That would be a new development. We know that there have been investigations on the civil side. There's a long-running civil case around their Medicare Advantage practices.
To understand why this is a big deal, you got to know how the Medicare Advantage works. When seniors sign up for these private insurance plans, the government pays the insurer a monthly premium based on how sick the patient is. The sicker the patient, the more money the insurer gets.
This is an area where we've seen increasing enforcement from the government over the past few years around how insurers bill the Medicare system in their Medicare Advantage plans, which has been a big driver of growth for the industry until recently.
Just to be clear, the company essentially denies that it's participated in any kind of fraud.
This creates a massive incentive for fraud. Insurance companies make more money by finding ways to add diagnosis to their patient records, even for conditions they're not actually being treated for. Last summer, the Wall Street Journal reported that UnitedHealth added diagnosis to patient records for conditions they weren't even being treated, triggering an extra $8.7 billion in payouts.
Tonight, as Luigi Mangione's murder case moves forward, reports that the Justice Department is now investigating UnitedHealth Group's billing practices. According to the Wall Street Journal, the new civil probe is looking into allegations the company profited off false diagnoses.
The market's reaction to this news has been absolutely brutal. UnitedHealthcare stock plummeted 17% in just a single day, hitting the lowest point in 5 years. We're talking about tens of billions and billions of dollars in market value wiped out overnight.
The insurers are paid a set rate for each patient, but can be paid more if patients have multiple health conditions. Wednesday's Wall Street Journal report of a new probe sent UnitedHealth shares plunging to a 4-year low. The company and the DOJ did not immediately respond to Reuters' request for comments.
This isn't happening in isolation. UnitedHealth has been hit with a series of major setbacks over the past year. Cyber attack at their tech unit, a tragic murder of a top executive, and now a criminal investigation. It's like watching a healthcare empire absolutely crumble in front of our eyes.
It would be the latest in a series of setbacks for UnitedHealth, one of the largest health insurers in the US. And Wednesday's report comes a day after UnitedHealth UnitedHealth Group's CEO Andrew Witty unexpectedly stepped down. The company also suspended its 2025 financial forecast due to rising medical costs.
Now, guys, here's where it gets really interesting. Just 2 days before the criminal investigation became public, UnitedHealth's CEO Andrew Witty suddenly resigned, citing personal reasons. Talk about suspicious timing. The company also suspended its 2025 financial forecast due to raising medical costs. But let's be real, when the CEO suddenly quits and the company withdraws its financial guidance right before a criminal investigation becomes public, it's not a coincidence. That's rats fleeing from a sinking ship. Stephen Hemsley, the former CEO and current chairman, has returned to lead the company through this crisis. But you got to wonder, what did Witty know? And when did he know it? And did he jump ship because he knew this scandal was about to explode? Adding another layer to this already complex story is the tragic murder of Brian Thompson, the CEO of UnitedHealthcare, a subsidiary of UnitedHealth Group, who was fatally shot in December outside a New York City hotel.
All of this as Luigi Mangione, the suspect accused of killing UnitedHealthcare CEO Brian Thompson, appeared in court, shackled and wearing a bulletproof vest. Supporters chanting, signs reading "Free Luigi," others demanding a fix to the healthcare system.
The suspect, Luigi Mangione, was arrested and charged with multiple offenses, including first-degree murder. Authorities believe he was motivated by the grievances against the U.S. healthcare system. While this tragic event isn't directly connected to the fraud investigation, it adds a complex storm to the crisis hitting UnitedHealth. This investigation is part of a wider crackdown on Medicare Advantage fraud. Nearly half of all Medicare beneficiaries, about 32 million Americans, are now enrolled in these private insurance plans. And the government is finally starting to realize how much these companies have been gaming the system.
Controversy because of the way that insurance companies and medical clinics can record diagnoses.
Right.
You know, they have the incentive to sort of record all the diagnoses they can. They get paid more.
Earlier this month, the DOJ filed a lawsuit accusing 3 major health insurances of paying hundreds of millions in kickbacks to brokers to steer patients into Medicare Advantage plans. It's becoming clear that there are serious systematic problems on how these private insurance operate with the Medicare system. So what does this mean for you and me? If you're on UnitedHealthcare Medicare Advantage plan, don't panic. Your coverage isn't going to disappear overnight, but you might want to start paying closer attention on how your health conditions are being coded and reported. This scandal exposes a fundamental problem in our healthcare system. It's designed to maximize profit for corporations, not provide quality care for patients. When we allow private companies to manage public healthcare dollars without inadequate oversight, this kind of fraud is inevitable. This could be the beginning of a much bigger reckoning in the healthcare industry. If UnitedHealthcare, the largest health insurer in the country, has been engaging in these practices, you can bet others are doing the same thing. The bottom line is this: we're watching what could be the biggest healthcare fraud case in American history unfold in real time. And it's a reminder the real healthcare crisis in America isn't about access or affordability. It's about the system that's been corrupted by corporate greed. Let me know what you guys think about this UnitedHealthcare scandal. And if you found the information valuable, drop your comments down below. Smash the like button if you kindly would. Share, subscribe. And as always, guys, I'll catch you on the next.